I'm Jane.
My name's Elaine Miller, and I am a pelvic health physiotherapist in Edinburgh. So that's a fanny physio. Anything you can do with a whiplash in the neck, you can do with a fanny. That's my job.
And I'm Bex,
And this is,
Insightful Sisters.
well, it's great that you've got so many opinions. That's what we want. That's what we want. We like to ask a few questions and then we like the touch paper and sit right back. So that's good. I'd written down you're also award-winning comedian.
Oh yes, I forgot that bit.
Yeah. And
I
introduce the world to the merkin.
so one of the challenges with leaky ladies, so work is mostly, stress incontinence, prolapse, problems with sexual dysfunction, that sort of thing. And getting women into clinic is a real problem because most of these conditions are manageable. Like women just get on with it. Women are really, really good at coping. So I wrote a fringe show. I had a hobby of doing stand up. So I wrote a fringe show about what I would do in clinic, called it Gusset Grippers. And it was basically just like a 101 for what your pelvic floor is and what it does. And it sold out and it got 5 stars. And eventually it won an International Comedy Award, which I was
Oh, get
rather
you.
pleased about. Yeah, because that meant that when my kids, who are teenagers, young adults, say you're not funny, mum, I get to point to a wee bit of perspex and go, I think you'll find I am, and that gives me great joy. So as the gender recognition bill, or the that's not even what it's called, is it GRR bill, gender recognition review
Act.
bill. It was changing in Scotland, so they were
Ah.
trying to basically bring in self ID, and the government would not meet with women, would
Mm.
not. And over the course of 7 years, they just persistently refused to listen to women's groups of any description and all description. So when the bill was going through and the vote was happening, I exercised my democratic right to protest by using an old type of female protest, lifting your skirt. But I knew that, exposing myself in Parliament would be a crime. That would be breach of the peace at the very least, and decent exposure. So I made a fake pubic triangle out of funky fur from the kids' craft box from when they were little, and had a temper tantrum at these 56 scumbags that voted to take away women's rights in Scotland. And one of the MSPs that didn't vote for the bill filmed it, which I didn't know he was going to do. And so that landed up going online in the press, around the world. That's how my kids found out that I had an opinion. So that was awkward.
And they found out you had fake pubic hair hidden away.
That was one of the things that was really surprising about that. The number of people like in the room, the number, because I know some of the MSPs now who thought that it was real.
Oh my
I'm like, come on, like it was like half a gorilla's worth of nylon. Like, what does this say about what we understand about women's bodies? And you're the people that are legislating for women's health, and you think that was real? Dearie me.
Well, there lies the problem.
Absolutely. There's work to be done.
Oh man. So we did something different for this. We asked people to send us questions,
Yeah.
asking for a friend. So I've got one for you here. This is
Yep.
Gertie.
Gertie.
Gertie
Hello,
Gertie's
Gertie.
Gertie struggles getting through the night without a wee.
Oh, yeah.
Does it matter? Is it a good should she get up and answer the call of nature, or
Mm,
should she try and hang on? Or go
mm.
on, give
It's
Gertie a bit of a nudge.
it's a real problem because it makes you tired and grumpy, and women who are tired experience more pain than women who are not tired. And
Oh.
we have fewer mood disorders. You're less likely to be anxious. You're less likely to be stressed if you've had a decent night's sleep. Everything is better if you've had a better night's sleep. And lots of women slip into routine where they're just sleep deprived permanently. It often starts when you've got young kids, and it doesn't really quite get back to normal. Especially if you've got children that historically they didn't sleep well, and you slip into a habit of, well, you're up, you'll just go for a pee. There's a phrase used a lot in women's health about just in case peeing, which is how a lot of us were potty trained. You know, go for a pee before you go in the bus journey, just in case you need a pee.
We call it a tactical wee in my household.
Right. So if you have got that in the back of your mind and you're waking up in the night, then you think, well, I'll just go for a wee while I'm here. But the problem with it is that that can disrupt the way that your bladder works. So bladders are designed to stretch as they fill with pee. And there's a muscle in the wall of the bladder that when your bladder's about half full, the muscle starts to stretch. And that feeling of the muscle on stretch tells you that you're going to need to go for a pee soon. So if you go to the toilet before your bladder's completely full, the muscle shrinks, it shortens so that then your bladder capacity is reduced. And then instead of you being able to pee, 300 mils or so of wee, like 350 to 500 would be normal for a woman, then you can reduce it to 150. So that means then you have to go to the toilet more often. And so then women have the problem where they're not having a decent night's sleep because they're having to get up to the toilet because their bladder's wakening them. And that further disrupts the mechanism because in deep sleep, you produce a hormone that reduces the amount of urine that you produce while you're asleep. So you'll end up disrupting the whole mechanism where you're able to hold less pee. That means that you get up, which means then you have a reduced quality of sleep. So you produce less of this hormone, so you produce more urine and you'll end up in a catch-22 situation. So normal, what we don't worry about is getting up once at night. But if it's more than once a night, then you're just not going to get 7 hours of good quality sleep. And the impact that has on your quality of life is enormous. So if you're a person that is getting up 2, 3, 4 times in the night, go and have a chat with your GP. There's lots that you can do about it. Some of it's just behavioural and like lifestyle management changes about, not drinking 6 cups of tea before you go to bed. Common sense stuff that probably you do automatically, you've just never really thought about it. So there's lots of minor changes that you can make that will reduce the amount of activity that your bladders do or your kidneys are producing pee, and then trying to defer so that you're able to get a better night's sleep. So yeah, once is okay. And actually we don't worry about it so much in women who are pregnant or women who are getting older, because as you age, you produce less of this hormone. So there's less concern if a woman in their 70s and 80s is up twice at night. But we've got to watch with that population as well, because if they've got a balance problem and they're at more risk of falling, we really want them to be rested. We don't want them to be, up and down 4 or 5 times a night. So the solution to it is doing your pelvic floor exercises can help, but a lot of it is bladder retraining, which I can send you some links for. It's like trying to look at what you're drinking, when you're peeing, and how much, what's the volume that you're actually putting out, and then trying to teach you ways so that you hang on for 10 seconds, 30 seconds, 10 minutes, and you try and extend the time. If somebody's up more than once at night, they're often peeing quite a lot during the day as well.
So that brings us to pelvic floor exercises. Probably a quick reminder at this point would be useful. I'm always watching people's eyebrows when I see you doing anything new. Is there...
It's a mystery. I have tried really hard to find a link between pelvic floors and foreheads, and I cannot find one, but lots and lots of women do that thing. Don't know why, it doesn't help.
Yeah.
So the job of your pelvic floor is to squeeze and lift. So the muscles hold your holes shut. They just sit in the bottom of your pelvis, like, if you think about it at Halloween and you see an image of a skeleton and the pelvis is just like a circle.
Mm-hmm.
So the muscles sit at the bottom of the circle and hold your guts up. So their action is to squeeze so that they can close your urethra for your pee coming out and your anus for your poo coming out. And they can also relax to let pee and poo out, or, if it's the weekend, maybe you want something to go in somewhere as well. Shake it all about. And they also lift to support the organs. So the action of your pelvic floor is 2 things. It's a squeeze and a lift. lots of women don't feel much of a lift. And somebody did a PhD looking to see what the best command was to get a good pelvic floor contraction. And it is, imagine you're holding in a fart, which makes me happy because farts are funny. So if you imagine that you are somewhere that you really, really, really don't want to fart, like, I don't know, Scottish Parliament in the middle of a temper tantrum, maybe. Then,
I don't know. I think you'd be quite prepared for that one.
Yeah, probably. Like Monty Python, I fart in your general direction. You're right. That would be apt. Okay, so if you think about being in a lift with your secret crush or a bunch of people that you wouldn't want to embarrass yourself in front of, and you're not sure if it's just a fart, if there's going to be a follow through, you are going to be hanging on with your bum hole. And if you think about what you're feeling now, because everybody will be doing it, then you can feel your bum hole clench. And if you really squeeze, it lifts up just a little bit. And that's the action of your pelvic floor. And you should be able to do the squeeze and lift and hold it for about a count of 10 is what we're aiming for. Lots of women can do it a bit, but it just sort of gradually eases off. So then they can't feel it anymore. And that's usually just a weakness problem. So if you do your pelvic floor exercises, that should improve. So squeeze and lift your bum hole, hold it for 10, 9, 8, down to 3, 2, 1, and then let go. And that is the one that will buy you more time. So if you go to the loo and there's a big queue, you'll be able to wait, with some dignity without being agitated and trying to nudge women out of your way so you can go to the toilet. But it won't help you if you laugh or cough or sneeze. So for that, you have to do quick contractions as if you're going to go, you squeeze thinking, oh, I'm going to fart. Oh no, it's okay, it's gone away. And you do that, a squeeze and a lift, and then relax, squeeze and lift, and then relax. But at that sort of pace, like sort of, on for a second, off for a second, and you're trying to squeeze as hard as you can and then completely relax afterwards. And you do about 10 of them in a row as well. And the evidence says that if you do a hold for a count of 10 and 10 quick flicks of your pelvic floor 3 times a day for 3 months, then 3/4 of women with just stress incontinence, the one where they laugh and cough and sneeze, will get better. So it's a feminist issue that we don't talk about this, because by not giving women information that they can self-diagnose and self-manage, then it delays them figuring out, in fact, they've got a problem, and delays them coming into clinic. So it drives me bonkers. However, so far, over the course of 15 odd years, I've not quite managed to get the government to fund anything, but I have hope. You never know.
Yeah. It seems to me to be quite a cheap way of improving an awful lot of people's lives.
Yeah, really. Like, pelvic floor exercises are really cheap to teach and they're free to do. And the side effect is probably an improved orgasm. So, it shouldn't be a hard
How does that
sell.
work? Because you're toning the muscles.
Yeah. So an orgasm is just a flickering contraction of your pelvic floor. Like, that's what generates the sensation. So if you've got a strong coordinated pelvic floor, the quality of your orgasm should improve.
Perfect.
I mean, that's a vote winner.
Absolutely.
We're in the run up to an election in Scotland. Maybe I'll tell John Swinney that's what he needs to do to get the ladies' votes.
Yeah, we should pass it on. I think a few of them are feminists to their pelvic floor, aren't they?
That's a great line. Feminist to my pelvic floor. I need that in a t-shirt or a pair of pants.
You'd only flash them. Anyway, I'm going to pass over to Bex. I think she comes on next.
We've got a question from Nellie, and that's around vaginismus and how to deal with that.
Yeah, that's a nuisance of a thing. So vaginismus is a diagnosis where women will have a sexual dysfunction, and it's usually linked with pain and penetration. And there's different types of vaginismus. So some of it is pain at the beginning of a sexual encounter that eases off, and others is pain that increases during a sexual encounter and gets worse. It can be like, it's quite common, and it can happen for no reason whatsoever. which is very, very frustrating for the women that it impacts. But it's definitely linked with things like having had a birth injury, or if a woman's been sexually assaulted, it's not uncommon that she, or just like an unpleasant sexual experience, it's not uncommon that she'd be left with sort of twitchy muscles. It's also a common thing in young women who have like type A personalities, the young girls that are getting really stressed because they're doing their exams and they're quite academic and they want to do well and they're just little stress bunnies. But when their shoulders go up because they're anxious, their pelvic floor goes up as well. And not everybody's got a weak pelvic floor. Sometimes they've got a hypertonic pelvic floor. So it's working all the time and it's not relaxing properly. And those women will have, it's quite common for them to have pain on penetration. It varies in how much it impacts on your life. So for some women, it's uncomfortable, but it eases off, and they just put up with it. They just accept that that's part of their intimate life. They grit their teeth and carry on, which isn't ideal because it, if you're going to do it, you might as well enjoy it. Like it's not. It really can colour a sexual relationship if one of you is not enjoying yourself. But for other women, it means that penetration can be impossible because the pelvic floor muscles contract, and that's partly what causes the pain. But if they're really clamped down, then it doesn't matter. You can't get anything in there, which can be an issue not just for sex, but for things like gynecological examinations. There's a lot of women that don't go for smear tests because it's just too painful. So what we need to do is figure out why the muscles are behaving in that way. It's almost like a primitive response that the muscles behave like that. Usually it's because your body is perceiving a threat and it's behaving to protect you, but there isn't actually a threat. But because you know that it's going to be painful, your body tenses up, your pelvic floor really tenses up, and that makes it painful. So it reinforces a cycle that sex hurts, and therefore sex hurts more. It's like a self-replicating cycle. So we want to break that. And there's a thing called Sensate Focus, which is a really good program that's, it's not new, it's been around for decades, where women, what we're aiming to get women doing is learning to be able to look at their body, so look at their vulva without the muscles starting to contract and being uncomfortable. And then can they move on to touching themselves? Then can they find bits that are tender? Because sometimes you can get localized spots of tenderness with vaginismus. So if you've got, like I was saying about having a whiplash problem in your neck, that people will have an exquisitely tender spot left maybe in their big shoulder muscle. And if you can get that tender spot to relax, then the pain changes. The same is true of up your fanny as well. It's just a muscle like any other. It's just a bit weird because of where it is. So if we can find these tender spots, then just like you would do with your neck or your shoulder, people get one of these tennis balls or spiky balls or massage and stretching. You can do the same thing to pelvic floor muscles. So there's quite a lot of poking about would be the technical term, I think, trying to find the bit.
Is that jiggery pokery, the technical term?
That's right, yes. If it's sore, give it a wee rub. You've got to watch though, because some of these tender spots can be really irritable. So if you can over-treat them and then it'll make the whole thing flare up. Often women have had these problems for years and years and years before they come into clinic. And either it's impacting on an intimate relationship so that your sex life is being badly affected by this and it's causing trauma and disharmony in the relationship. Or they're getting pain that's extending out with sexual encounters. So they get a lot of pelvic aching and problems peeing and problems pooing. So I can put a link actually for Sensate Focus stuff. Sensate Focus is it's really good. It does work, but it's written for couples. And it's written for a couple where it's a woman and a man, which irritates me enormously. Yeah. And also the focus is entirely in any of the sexual rehab stuff, when you read about the literature, it's almost always focused on, can you get it in, love? And medical literature hasn't quite figured out that sometimes women quite like having a wee bit of sexy time on their own, or maybe even in the absence of a penis for their entire lifetime. So I've done an adaptation so that it's about the woman in her own trying to, see what's comfortable, see where the problem is. A lot of the answer is just common sense stuff like deep breathing and reassuring you that there isn't actually a threat. Like, this is supposed to be a nice experience. It's just that your body's, dialed up to 11. What was that film, Spinal Tap? The volume goes up to 11. So your sort of level of threat in your muscles is dialed up too far. So all you're trying to do is dial them down again. Treatment can work really well. Like physio for vaginismus is really successful. It can take a bit of work to get it to settle down. It's usually, there's quite a lot of stuff that the woman has to do at home in the way of homework to try and continue the improvement. But to be honest, most of the women that I see with that sort of presentation, they do get better, but it can take 6 months or so.
Okay. Is it hard to find support, or is it sort of...
Yeah, it's a real problem because there's a huge amount of shame and stigma that surround, it's really, going and talking to your GP about a sexual problem can be a real issue because nobody wants to be judged. Nobody really wants to talk about these very, very personal things. A lot of the time you don't want to talk to your partner about it, let alone somebody that you might not know very well, especially because GP practices are under such stress. A lot of them are using lots of locums. It might be somebody that you've not met, or even worse, it's somebody that you have met, somebody, that's of the opposite sex or is older or is the same age as you or younger than you. It can be quite a challenge to be able to discuss these things. I wrote a form, actually, I'll send you a link for that, which is I have an embarrassing problem or a problem I find difficult to talk about. You can just circle all the words so that you can give like a potted history to the GP without even having to say anything. But it can be quite helpful to frame the wording of it so you're able to articulate it to your healthcare professional, who are always just delighted that you've come into clinic. Like, although it's a big problem for the woman, usually it's bread and butter to the person that you're talking to, and they're not going to judge you. That old adage that healthcare professionals say about, oh, I've heard it all before, love. Like, it is true. You have to be doing something really outrageous to even register what it is that you're talking about. So I think it's a shame because, like, sex is just part of being an adult. It's not a more complicated bodily function than exercise or sleep. It's just part of what your body does or should be able to do. But because there's all the sort of value judgments that are put upon individuals, particularly if they're women, then it does become much, much more complicated to even recognise that there's a problem, because how do you know what normal is? Women are taught from a young age that sex hurts. You're told by lots and lots of sources that your first time's going to be sore, you're going to bleed, sex isn't that great for women, that, it's nobody has an orgasm ever, and there's a lot of myths. So I'd quite like to see all of that sorted out in sex ed so that young women understand what they can reasonably expect from the genitals, like what is normal sexual function, and then you're more likely to know if it's abnormal. But sex shouldn't hurt unless it's something that you are actively seeking out, because some women like, a bit of pain in sex, and that's fine if you're consenting to that or initiating it and they're consenting. But if it's unwanted pain, you shouldn't have to put up with it. You certainly shouldn't be told, just have a glass of wine, love, see if you can relax. Yeah.
You mentioned there as well, this can be a barrier to accessing a gynecologist or smear tests or things like that. I mean, how much of a concern is it if it goes untreated? Does it get worse, or?
It does tend to. There's not like a medical cause for it. So it's one of these conditions that women can get dismissed with, or they'll have a bunch of examinations done and there's not a cause found, a medical cause. So often women in that situation report that they feel that they've been told it's all in their head, and it's not. Like, the pain cycle is a thing. It is well recognised, it's understood. It does tend to get worse over time, but not because there's a pathology going on, just because the anxiety gets worse, because you've got pain that's interfering with something that you really want to be doing, or is ruining the experience. That's not going to, like, sex is supposed to be an enhancement to your quality of life, not something that's a source of anxiety. So that perpetuates itself, so the problem becomes worse over time. Usually because the anxiety is the trigger for it. When it comes to gynae appointments, like, it's not uncommon for women to be offered the use of something like lignocaine beforehand. So they're given a gel that will numb up their genitals so that it's possible to have, a gynecological procedure or sex, penetrative sex, which, like, just gives me the creeps. Like, it's really important that you're penetrated, but you're not going to feel it. That's the only way we can make this happen for you, love. It's a bit Handmaid's Tale. And sometimes, like, the other side of it is that if the woman doesn't understand what sexual arousal is and how it works, or if her partner doesn't understand, if your partner is basically just a really clumsy lover, or we're seeing a big problem with porn having an impact on how partners think, or actually anybody, the youngsters now, what they think sex is and what is expected in a sexual encounter is not necessarily what's going to give an optimum experience for either of them.
I think we could use reviewing how we teach sex education in this country and taking a new approach to it, perhaps. It still feels very dusty, our approach to sex ed in the UK, I've got to say.
Yeah, it is a real challenge, but things like vaginismus respond really, really well to education. If you understand what your body is likely to do and what is not normal, then you have fewer of these sort of painful conditions. We see less of it. So if it's a problem for you, then I'll send you this thing, this adapted sensate focus. Give that a shot, which is basically having a look, having a poke around. See, for having a look, patient told me this brilliant tip that she had a partner that was a mechanic, and they have mirrors on extendable, like an extendable rod thing.
Yeah.
And it's got a wee mirror in the end with a light that attaches on it, so you can position yourself so you can see in the mirror. But like they used to use when they were checking underneath cars for bombs when the Troubles were on in Ireland. It looks to me like that. But it's £5 off of your favourite online seller. It's a thing of genius. So get yourself a wee mirror, have a look, then have a wee poke about. Having a poke about in the bath, like just touching on the outside, and doing that in the bath, somewhere that you're going to be nice and relaxed. And what you're looking to do is do each step without it making these muscles overreact. Lots of deep breathing can help, and just taking your time. But the key thing that I would encourage women is just not to put up with it, because life is too short. Like, if you're going to have fun, then it would be nice if it didn't hurt you.
Yeah, absolutely. I really like the idea that some poor police part supplier is going to be absolutely confused by he now is going to get a load of private cells from women.
There's probably some dark part of the internet that's already set up and established. Just reuse, recycle.
Yeah, it's all in a green spirit, really, isn't it?
Yeah. What did happen to all of the Gardaí's mirrors for bombs? I don't know.
Right, well, I'll pass back to Jane then.
I love that idea. I was thinking selfie stick, which works.
That's the word. That's the word. Yes, you can't do that. Like, I have had women show me their problem with a photograph on their iPhone, you can actually tell quite a lot. Like they're using it in the NHS and have done for a long time, of doing like dermatology appointments through just showing on your camera.
Oh yeah.
The problem with that, I think, is you need to be aware that you're then carrying pictures of your genitals on your phone, which, you know, it's just something to bear in mind.
Yeah, it's not a good look,
that
is it?
you might want to put that in a wee secret folder in case, I don't know, your toddler gets hold of your phone in the bus and everybody's suddenly looking at your fanny on the bus. But it's really useful in clinic, but you've just got to be mindful.
We've asked, well, a listener called Winnie asked us about young women. There's a lot of young women now that are taking male hormones.
Oh yeah.
What's going to be the impact on them long term, health wise? What's going to happen?
Well, the short answer to that is we don't know, Jane. The research isn't there. We don't know. However, best guesstimate, there is lots of evidence from what happened in the 70s and 80s with female athletes in Eastern Bloc countries who were given androgens. They were given what's effectively, you know, the steroids that they were given to enhance their athletic performance were very closely related to testosterone that these young females are taking. And what happened to those women who were like at the pinnacle of physical fitness, you can't get fitter than an Olympian, is many of them died prematurely. And we don't know why, because that happened in the Eastern Bloc. So obviously, if they did do any research, it's going to be very difficult to find it and access it. That's not what those regimes would have wanted to get out into the West. But we know that so women produce estrogen from their ovaries and also a small amount of testosterone in their ovaries. And we know that at menopause, the loss of estrogen has a big impact on women's wellness. So women are less likely to have coronary heart disease and less likely to have heart attacks than men are until they are menopausal. And then we lose the protective effect of estrogen. So given that a lot of these athletes died prematurely of coronary heart disease and related conditions, then I think we could assume that the problem was that they were effectively in a menopausal state prematurely, and that increased the risk of heart attacks and strokes and these sorts of devastating conditions. Mm-hmm. And anecdotally, from looking at what you read online, which, you know, isn't science, but a lot of the sites are anonymous. So I think some of it has probably got an element of truth in it because people can talk freely. They can also, you know, lie with abandon. But there does seem to be a number of people that are quite high profile that are, you know, they're female, they're women, but they're taking cross-sex hormones, or the blogger or YouTuber has got somebody in her family that fits that description, and there has been a number of them that have died of heart attacks, like in the 30s. It's really worrying. So I think that we should consider that anybody that's taking cross-sex hormones, taking large doses of testosterone, which is different from what a GP would prescribe for a woman with menopause, that if she's got the NHS care pathway would say that if a woman's got loss of libido, then they would prescribe or could prescribe her small doses of testosterone to help with her libido, which takes us back to talking about sex. You know, like, why is that the important thing? It's not her memory loss or brain fog. It's not that she's tired and she's got joint pain, all of which might respond to a small dose of testosterone. But if she's gone off the idea of sex and there's a man suffering at the end of it, then the NHS will prescribe the testosterone. But anyway, that's another rant. But what these young people are doing is taking large doses of testosterone. So they're taking male doses. And it seems that in that community, some of them are not just taking what they've been prescribed at a clinic. If they're under the care of a clinic, they're topping it up on the black market. And there are people that have transitioned that tell me that they make their own. I don't know how they do it. Presumably it's like Breaking Bad sort of level of of effort. But certainly there's people online that are male that have said that they're making their own estrogen and selling it to other male people. So
Can't be safe, can it?
no, it's not safe to make hormones in your bath. No. So I'm really worried about it because the way that cross-sex hormones are framed from the genderists, so from the gender clinics, is this will make you feel better. And the underlying reason that anybody goes into transition is because of distress.
Yeah.
They are these in the females certainly. I mean, it's a bit different in men. Often, we understand that there's often an erotic element to that, but for the young females, often there's just a distress, and their gender issues a manifestation of distress. That's what there's big debate about what the cause of it is, and is gender dysphoria a separate thing, or is it just another way that a person would display distress for whatever reason they're distressed? So what the big lobbying groups say and what the gender clinics say is that, well, you're distressed because you want to be male. So if we give you male cross-sex hormones, then you'll be happy. And testosterone's a really powerful hormone. So if you take it and you're female, you do feel great. There's a very good book by Carol Hooven called Testosterone, where she studied the effect of the hormone, what it does in the animal kingdom and in humans. And the women that she interviewed in her book that were using testosterone, the accounts in that book mirror what I've been told, that you just feel amazing. There's a reason men are in charge of everything. Like women take testosterone, they feel really strong, really self-confident, really like centered in themselves, really confident and really horny. So that lasts for a while. And then usually within about 3 years or so, then these women start to get symptoms of menopause because they're not male. And by taking the testosterone, they've knocked out their own ovary function. So they start to get weight gain, joint pain, memory loss, and vaginal atrophy. One of the early symptoms or side effects, or it's not even a side effect, it's an effect of testosterone, is on the genital tissue itself. So they get women's clitorises will enlarge, and they can become quite large, and that's, it's not a pleasurable thing. It's really uncomfortable because it can it can protrude from their external labia, and so then it's irritated in their clothing. It's really very uncomfortable indeed, and that change is permanent. That even if they stop taking testosterone, their clitoromegaly will persist. But because all of your genital tissue is really thirsty for estrogen, then it thins if it doesn't have estrogen. And vaginal atrophy, or this is a symptom of menopause because you're not naturally producing your own estrogen, and it progresses over time. So we want women that are menopausal to, if they've got symptoms of burning or itch or thinning of the tissues, to start to get lots of urinary tract infections or bleeding with sex, or it's just really uncomfortable and raw. Sometimes women describe like having paper cuts in their vulva. Then go and speak to your GP about getting vaginal estrogen for it, and it works. It's brilliant stuff.
I think I'm going to pass across to Bex, because we had a separate question, didn't we, Bex, about vaginal atrophy? Because I mean, in a way, we've got two, like you're saying, we've got two groups of women that are suffering from it. And
I think we should treat them the same.
But just before I do pass over, one of the other things I've noticed is, and you will have noticed this, if you go to anywhere where there are trans activists protesting, so many of the young women have a walking stick.
Yes.
And that's, I mean, yes, it's completely anecdotal, but it is noticeable, isn't it?
It'd be really good if we could do some research into why they've got walking sticks. What I notice is that they don't have NHS walking sticks. They don't have like the standard grey handled, silver coloured, plain walking sticks. They are pretty funky, coordinated with their outfit walking sticks that they're buying privately. And there's quite a lot of the people that I see them with a walking stick, and then they've got two, and then they've got a walking frame a wheeled walking frame. And then I'm now seeing people that I've seen around for 10 years or so that have got electric wheelchairs, but they're also not electric wheelchairs that are NHS issue wheelchairs. So I don't know why that is, but I suspect that it's almost like, if you're trying to identify with a group and some of the group have got joint pain and they're using a walking aid to help with the joint pain, then do you need a walking aid as well to have the badge to show that you're belonging to this group? I don't know. It's like psychology is not my field, but I would be really
it all needs a
interested.
lot of research, doesn't it? We're woefully short.
If a psychologist or a sociologist could look at why in the last 5 years this massive spike of young people are needing walking aids, I think that'd be really, really helpful.
Yeah. Right, I'm going to pass across to Max, but that's fascinating. If there's a researcher out there, please get in touch with Elaine.
Yeah.
You've sort of mentioned there around vaginal atrophy that we've sort of got two different groups of women that are struggling with it. Could you tell us a bit about it, what it is and what normally would cause it, aside from cross-sex hormones?
Yeah, so just loss of estrogen. Female reproductive tract and genitals, the tissue of your genitals just really likes estrogen. So when your body naturally produces less of it, then these tissues complain and they thin. So the main symptom that women will start to talk about is that they have like a tenderness in their vulva. So when they're cleaning themselves after they've been to the toilet, it can be painful, it can be really sore. And instead of wiping, they stop wiping and they start dabbing instead, because the dragging of the tissue on their vulva is really uncomfortable and can leave them with these little sort of paper cut sensations, which are really sore. If you've got a paper cut in your fanny and then you go and have a pee, like, it's not fun.
Gosh, yeah.
Yeah, it can be really sore. It's also linked with an itch. So sometimes women, again, their sleep's interfered because they've got an itch that's really intense and it stops them from being able to sleep in their bed at night. And it also, because it's a thinning of the tissues, so they can land up with loss of labia size. They can land up with loss of size of clitoris and their clitoral hood. And the tissue around their urethra, around their pee hole, also thins, which means effectively their urethra widens, which means it's more space for bugs to get in there. So it's linked with urinary tract infections. And there's a train of thought amongst the urogynecologists that all women from the age of 45 should be offered vaginal estrogen, because you will be producing less estrogen by the time you're 45, because the average age of menopause in developed countries is 51. And it doesn't happen overnight. Your ovaries gradually go into retirement. So there should be a conversation with a woman about this is a common problem. And the treatment is, the care pathway in the UK anyway, is 2 pessaries, or one pessary twice a week. Yeah. And estrogen cream on the outside every day, and do that for a few weeks, and then you can reduce the dose down. It takes about 3 months usually for the tissues to zhoosh back up again, and then women can stay on that treatment for life. But it's important that we catch it and actually do something about it, because over time these symptoms get worse. So most women in their 80s, definitely women in the 90s, are likely to have some sort of thinning of the tissue on their vulva. And the symptoms of it can be really, really annoying. So why would you put up with it when vaginal estrogen is really safe to use? It's a very, very low dose. So even if women have got a history of an estrogen-driven cancer, if they've had endometrial cancer, ovarian cancer, breast cancer, because the amount of the hormone is going straight into the tissue, it doesn't get into your blood supply. So it's so safe that NHS England lets women buy vaginal estrogen over the counter without seeing a GP. And I think we should just be talking about it and slapping it on thoroughly. It's smashing stuff. And I also think that any person that is under the care of a gender clinic that's been prescribed cross-sex hormones should be prescribed vaginal estrogen, because there's no need for them to put up with these symptoms. Obviously, it can make sex really painful. If you've got a dry, thinned vagina that's not as stretchy as it used to be, it's really uncomfortable. So I think there's a lack of education, and I think it's established. You know, Hannah Barnes' work in Time to Think showed very clearly that Tavistock was not giving people enough information about taking these hormones, and I don't think that there's any difference from any of the other clinics. And for older women, we just don't tell them that this is what is inevitable, like hot flushes and brain fog and joint pain. That sort of symptoms of menopause usually burn themselves out, but the vaginal dryness doesn't. It just gets worse as you get older. So speak to your GP and slap that stuff on.
Is this something that is normally linked with menopause, or can it naturally happen in women of any age? Or
it's linked with menopause, but it also can be a problem for breastfeeding women, because when you're breastfeeding, then your estrogen levels are suppressed as well. That's why a lot of women, when they're breastfeeding, they don't menstruate, because your body knows that you're supporting an infant, so it's not really in your interest to get pregnant while you're breastfeeding. So it's not uncommon for women to menstruate irregularly or not at all while they're feeding a baby. And because their estrogen is low, then they can land up with, it's not like a true vaginal atrophy because it is a temporary thing, but they can get a very raw, sore vulva, and it can make sex very painful. So there's a discussion about, should we be offering this to breastfeeding mothers? It's not a reason to wean your baby. You know, if you're breastfeeding and then you realise, actually, I've got a really red, raw, itchy fanny, and that woman's saying what, then your GP would probably prescribe it for you just for that reason. And some medications can affect estrogen levels as well, like some chemotherapies and all sorts of things can have an effect. So if you've been told that you're low in estrogen, then it's worth bringing it up with your GP. It's dead cheap. This stuff is really, really cheap. It's really effective, and there aren't really side effects to it. So, big fan.
It's good as a preventative measure, then.
It really is. Yeah. If like urinary tract infections are unpleasant when you're in your 20s and 30s and 40s, but once you get into your 70s and 80s, it can be dangerous because they make women confused when they've got a urinary, like you can meet a woman who's got an acute urinary tract infection and think she's got dementia.
Yes.
And all she needs is 3 days of antibiotics, and then she's, absolutely fine again and restored to herself. And so you don't want women that are getting older getting urinary tract infections and being confused, because it's dangerous. And also it's linked with burning and urgency of peeing. So they hurry to go to the toilet, and that's a falls risk. And we don't want older women falling. It's not good for us. So I would do a lot more with vaginal estrogen, because there's really no reason not to. It'd save a fortune.
Yeah, sell it by the bucket, by the sounds of it.
Absolutely, yeah.
Right, well, I'll call Jane back in then. I think she wants to ask you about pelvic floor exercises.
Great.
Well, we sort of covered how to do it earlier on.
Mm-hmm.
How do you make yourself do it? Like tips for sort of putting it in your calendar, getting it established as a pattern?
Oh, because dear Lord, they're boring, aren't they? like they are dull exercises to do, very, very easy to forget. So it's a problem. So what the evidence says is 3 times a day for 3 months helps for stress and continence, but we don't know what optimum is because nobody's done the research. So in clinic, what I find is that if women do them a bit some days and loads a couple of days and then not at all for 2 or 3 days, they still get better. So I don't stress too much about exactly how often you're doing your pelvic floor exercises, because something is better than nothing.
Yeah.
There's a very good app you can get called Squeezy, which is a great name for an app, and it's NHS endorsed. And if you're a person that likes a streak, then it'll show you the streaks of how often you've done the exercises, and it talks you down through like holding for a count of 10. You can change the settings, you can mess about with the settings a bit on it. So if you're a person that likes an app, get Squeezy. Setting a reminder on your phone works. I sometimes try on Twitter to do a clench along, so I'll put a song out that's got, you know, a pun in it, like, I don't know, I can't get no satisfaction, or shake it off, or something that's got a pun, and then you try and do
me now.
Right. So you try and do one clench per beat, which isn't evidence-based, but it is interesting to see if you can actually do it, if you can do fast contractions or not. The thing that motivates women most is usually what has motivated for them to come into clinic. So the women that are living with a problem don't tend to do their exercises enough. It has to get to a state where their problem manifests itself in a way that they can't tolerate anymore. So usually there's something that's happened that's really embarrassing, or they had a near miss and it would have been horrific, and that's pushed her into coming into clinic. And those women are really adherent. Those women do their exercises because they've seen what's going to happen if they don't, and they are a very motivated group. So it's good if we can catch them before that stage, because it's just unpleasant. The stories are always horrendous. But it takes an average of 7 years for a woman to come into clinic. Like, women cope. So when you're talking bluntly, because I'm not examining anybody, if I examine you, I can say to you, you know, more of a guesstimate about what will be helpful and not. But just as a blunt tool for speaking to people as general advice, something is better than nothing. So if you do them every day, a clench for a hold, count for a hold of 10, and then 10 quick flicks in a row. If you can do that once a day, every day, then you should see a difference. If you can do it more times every day, then you'll see a difference more quickly. And the main thing is, if it doesn't work, then come into clinic. So it's either not working because you're not doing the exercises well enough. You know, you've got weakness that's so pronounced that you can't initiate the contraction, or the muscles are not relaxing. It's like the women with the painful sex and the wee youngsters that are all little stress bunnies. So the muscle's not relaxing enough. And in that case, the pelvic floor exercises are not going to help. You need the muscle to relax. So it's either that it's too weak for you to initiate the contraction, muscles are overworking and it's not strengthening that they need, or your technique is not right. So if the pelvic floor exercises don't help, then come into clinic, because physio is really successful with this stuff, really successful.
You said it's boring to do. Do you ever get bored thinking about, or having people ask you about it?
No, I would say that I'm not bored of it. I'm incensed by it. Like, I don't know if it's menopause, but I spend quite a lot of my time just being furious.
I feel like
things.
You're that sort of person on a lot of things, aren't you?
Yeah, it's just, I just collect a bunch of things. Well, that's not good enough. Like, how can it be that we've had the solution for a significant number of women? So if it's 1 in 3 women that wet themselves, and the majority of those are living out in the community, just, you know, using pads and bits of loo roll and drinking less, so that going to the toilet just in case, and not having sex, not going on holiday, not wearing white trousers, they adapt their lives. If we've had the solution to this for 40 years and we haven't told anybody about it, what is that? Like, I'm not bored, because that's just outrageous. We are making, as a society and as a profession, we're making an active choice to let those women have their quality of life impacted for no need, just because we can't be bothered running a public health campaign. I think it's really lazy. And
do you think it'd be different if it was testicles?
Of course it would. There's 14 different medications at the last count. I haven't looked recently. 14 different types of medication to treat a loss of erection in a man. And for sexual dysfunction for women, there's one medication, but you can't get it in the NHS, because if you take it every day for a month, it'll get you an extra quarter of an orgasm in the month. And it doesn't work if you're a woman that's got a relationship stress, that's got a problem with your body image, that's got, like, you name all the things that will happen to women in middle age. They're the things they say it doesn't work for. And if you drink alcohol while you take this drug, it'll give you a stroke. So the NHS won't give
I
it
know
to
which
you.
one I've chosen.
So it's just misogyny. And I'm quite motivated by that, because it's just outrageous. Men would not put up with their testicles shriveling from the age of 45 and it starts to make it sore when they had a pee. Men wouldn't tolerate that.
No.
So we shouldn't either.
No.
So maybe I'll get bored eventually. Maybe when I can get my public health campaign out, maybe then I'll be like, right, I'll move on to knees.
Move down the body.
I don't know. That's before we even think about prolapse and all the birth injuries and all this stuff. Like, there's so much about women's health that we don't know. There's a shocking figure that, so out of all of the money that's put in the UK into publicly funded health research, women's health gets 2.4% of the budget for everything. Anything to do with breastfeeding, anything to do with endometriosis, anything to do with birth injuries, anything to do with anything, breast cancers, anything that's just for women, 2.4%. So there's a problem. So we need to find solutions that are cheap to teach and free to do. And if you give the women the information, most of them will self-manage, because we're all far too busy to make time to go into clinic in the first place. You need to take time off work, you need to organise childcare or care for your elderly mum, and the parking's always terrible, and if you can avoid it, you will. So I need to get on with finishing my book, really, don't I?
Yeah. And saving the universe. I'm going to Bex.
Just out of curiosity, are pelvic floor exercises useful for dispelling period cramps at all?
They can be.
I know people say that belly dance, don't they? They say that that sort of gentle movement of the muscles around your stomach can help.
Yeah. Any movement's good for pain, like anything at all. Because we used to say if you had low back pain, you should go to your bed for 6 months to, manage your sciatica, but they've changed their mind about that. Movement's good. And it's partly because there's a neat phrase that they say, motion is lotion. If you can get movement going, then the joints and all the little tissues that slip and slide over each other, they lubricate themselves. So it does reduce pain quite, even just something really simple like going for a very short walk can be really, really helpful. So, and belly dancing is a great laugh, and you're doing it with a bunch of women and you're seeing your friends. It's a social event, so it does make you feel better. There's not anything that directly says that doing your pelvic floor, or not anything that I'm aware of that says directly doing your pelvic floor exercises will help. But if you've got like engorgement of the tissues, then getting them squeezing should help in principle. So
basically as close as you can get to giving yourself a little massage, isn't it? A little interior massage.
Yeah. But if you've got severe like menstrual cramps, just get the drugs, man. Get some mefenmic acid down your neck, Ponstan, it's brilliant. Go and speak to the GP. Don't put up with it. If you're flooding through like a sanitary towel within an hour, or if you're double using 2 sanitary towels one on top of each other, go and speak to your GP, because that's a lot. That's not normal bleeding. Not if you're needing to use pain medication and you actually can't function because you're in so much pain. Please don't put up with it.
Yeah. There we go. You heard it here first. Go and get your drugs, ladies.
Just say yes.
So we come to our final question, which we ask every episode, and that is, do you have a woman of the moment?
I do. And I am going to say Naomi Cunningham, who is the barrister for all the TERFs. Like, are you a proper TERF if you've not had Naomi Cunningham represent you in a tribunal? Because if you've not, you're not doing it hard enough. It's been really interesting seeing what's happened with Sal Grover's case starting yesterday in Australia, which I watched a bit of it till about 2 a.m, and then thought, I really have to go to bed. I can't sustain this all night. It's really interesting watching how different lawyers handle things. And I think that Naomi is a gift to us on Turf Island. She's so exceptionally able to deliver an argument in a way that's really polite and engaging. And she sets them up. And then you see 2 or 3 days later, she's like, bam, you said. And she's unflappable, and clearly the woman must, never mind 4D chess, she must do 10D chess. It's a thing of joy to watch her work as she deconstructs these belief systems that people that are in the judiciary themselves hold. And I just love Pete the plumber, Pete the manly man. It's we're very, very lucky to have so many capable people. I can't understand the serendipity that means that we've got all these women just that are in the right job at the right time, that have all coalesced in the same place.
I think it's because all the best people get this. That's my theory.
That's yeah.
We have kind of got the Turf A team over in this country, though, haven't we?
Well, more in Scotland, particularly. I mean, I was looking at our list of people that have been on the programme and the podcast, and we were about 30% Scots at the moment.
Yeah.
With a lot to say.
Scots get things done, that's why that is.
Amazing.
There's another research project needs to be done. Like, what is it about this time that there's just a bunch of women going, aye, right? In quite a small geographical area. It's fascinating.
Home of the Enlightenment. This is the second one.
Yeah. So that's my woman of the moment.
That's a great woman of the moment.
We must protect Naomi Cunningham at all costs.
I mean, you're not a real turf if you've not had a little schoolgirl crush on Naomi Cunningham.
Yeah.
She's just fab. I loved the non-binary, the Spanish non-binary, and I just loved that.
In Rose Adams' case.
Yes.
Yeah. Just genius.
Oh, this has been so fun. Thank you so much.
No, thank you. Thank you for doing it, because we need more female-run podcasts. I keep threatening to do one myself, but the editing, maybe I'll pick your brains, Bex, about how you actually do it. I'm kind of tired of hearing men talk about sex and gender stuff, so I'm really grateful for you doing this, because it's a big effort, but it's fab.
Thank you.
Thank you.
It's been fabulous. Thank you so much.
No, thank you. Thank you for having me on. That was really lovely.
It was great.
Really good fun. Yeah.
Thank you to our listeners. We really hope that you've enjoyed this episode. And if you have, please do like, share, comment, subscribe, all that good stuff to help keep our channel growing and spread the word. Thank you.